welcome back to The D Word with me, Dean Major. And today I just want to briefly talk about depression and what depression means to me. And I want to start out by saying that the name given to this disease is one of the worst names ever used in the history of medicine. Depression is so often confused with sadness, and we all experience sadness. And I just don't like the fact that depression is so easily used in place of sadness. For example, you get a lot of people say, "Oh, I'm really depressed because the weather is so shitty." That's sadness. Depression is something far deeper rooted, something that is crippling in its most extreme form. If you suffer from depression, there are times when you will just lay in bed all day perhaps because you simply do not have the willpower to get out and face the world. And depression also goes hand in hand with anxiety, which we'll discuss at a later date. But for now, I just want to talk about when I first knew I had depression. And I would say it was probably early teens. um, I had a wonderful, wonderful childhood. I couldn't have asked for a better childhood, but there was a number of factors that kind of brought on depression for me. Most primarily was being the victim of bullying, which went on for a number of years. And aside from the bullying, and which I found out in later years, there's a chemical imbalance, which I, take medication for, and that imbalance has now been balanced, so I'm able to function as a normal member of society, which was not the case before. Um, and the thing about depression is it affects people differently. For me, it just made me withdrawn. I really didn't want to be around people. And as is true for many sufferers, one really big indication is the loss of interest in things which once gave you a great deal of joy. Um, so if, for example, you're a parent and you know, you become aware that your child is no longer participating in things that they used to really enjoy, that's quite possibly a sign that depression has onset. And it's really hard to put into words what goes on in the mind of a sufferer, but you can be one day you can be having the best time. Say it's, I don't know, playing tennis, playing golf with your friends, and then the next again day, you just you're saying to yourself, why was I doing that? I hate tennis, I hate golf. Obviously you don't hate those things. It just so happens that the depression is clouding your judgment, and you just don't want to take part in those things. Again, anxiety plays a part in this. It's social anxiety. You don't want to be around people, but it goes a lot further than that. It's when you have this feeling of low self-esteem, and that's a terrible, terrible thing to get out of. I've been there so many times. You just feel worthless. You think, oh, it doesn't matter what I try and do. It's gonna suck. Why should I even bother trying? Because I'm useless. I'm worthless. And when you get into that mindset, it is very, very difficult to escape from that. Um, the the depression just manifests itself in your brain, and you just don't want to attempt anything because you think you're going to fail. The things you used to enjoy, you stop doing. You can't think of anything that's going to bring joy to your life. You might think, well, you know what? Maybe I'll go meet a friend and have some coffee. and then you think, oh my God, I don't want to leave the house. I really don't. Um, and the bed becomes a sanctuary for depression sufferers. You know, it's the one place you feel comfortable because there's nobody watching you. There's no, you know, you're not forced to interact with anybody, and it's unless you suffer from depression, it's really hard to try and explain to a non-sufferer just how bad it gets. But you know, fortunately, there are a number of ways to you know, combat these feelings of depression. For me personally, the really only method that has worked is medication, and I will go into talk about medication at a later date. But you know, it's a chemical imbalance, and drugs, you know, correct that imbalance and allows you to live a normal life. Another method which is often promoted is therapy. I've, you know, I've seen a number of therapists over the years, and you know, some of that therapy has worked to an extent, but I'm not a fan of therapists, simply because I really have this feeling that yes, they've studied the subject, you know, they're very knowledgeable people, but for the most part, they haven't suffered themselves. So they're kind of, you know, giving you a textbook theory as to why you're feeling the way you are, but it really does take a fellow sufferer to understand his fellow sufferers, and that's why I'm doing this. So I'm hopefully, you know, this is a very brief outline of the depression symptoms I'm giving you this very minute. I'm going to go into it a lot, or in a lot more depth down the line. But again, if you are somebody who has just lost interest in the things you once enjoyed, if you would rather lie in bed with your head under the covers all day than face the world, or if you just have this feeling that you're worthless, that you're useless, that nobody, why would anyone like me? You know, I'm the worst person in the world. You know, these are all very common things that people who suffer depression, these are things that people go through, and you know, I just want to say again, if you have children, or even if your spouse, if their outlook on life has changed to the point where they become withdrawn, or you know, they just don't want to take part in anything, they want to avoid family gatherings, they no longer, you know, talk to their friends, you know, this very good chance it's depression. So just be mindful of these indications that, you know, people close to you are going through, and you know, talk to them, you know. And the other thing I want to say right now before I close this quick video off is that it's nothing to be ashamed of. It's a medical condition, the same as diabetes is a medical condition, and people take medicine to combat their diabetes so they can live a normal life. Therefore, there is absolutely nothing to be ashamed in if you have to take medicine to counteract a chemical imbalance. You know, if depression showed itself by way of, you know, if your hand was to turn blue because you were depressed, people would be a lot more understanding because they can see the symptoms. Depression has no physical appearance. It's all inside the sufferer's brain. So, you know, don't be afraid to ask for help. Do not hesitate to go see your doctor and tell him how you're feeling. You know, he may be in a position to prescribe medication, or he more than likely will refer you to a trained psychiatrist. But in any case, do not be afraid, do not be ashamed. This is something that affects millions upon millions of people, and you know, it's okay to ask for help. So I urge you, if you are feeling in any symptoms that I've described, please just go get help. Help is out there, and I am the living proof that that help can work. So again, thank you for watching this. I know it was very brief. I just wanted to get some videos made to add to the channel, so it's not just one or two videos out there. So again, thank you, and there will be more videos to come. Thanks for watching.